Hi, I'm Tom Eschen, and this is the award-winning Power in Politics podcast, the conversation about the issues that are impacting you the most with the people, the advocates, the officials, the members of the community trying to spark change, holding them accountable, asking the tough questions along the way at the same time. Today we speak with Dr. Cynthia Leifer. She's an immunologist at Cornell University, responding to RFK Jr., the federal government canceling $500 million in mRNA vaccine contracts that includes 22 projects. She says they're not saving much money and could have a negative impact for years to come on the research they're doing, especially at Cornell University. We talked to her about some of the claims that RFK Jr. has been making about all this, saying mRNA vaccines do not adequately prevent respiratory infections like COVID-19 or the flu, and also their proposal, their way to replace all of this with a safer, broader strategy, a universal vaccine, what she has to say about that, and the impact it could have on cancer research and finding a cure for that as well. You can listen wherever you get your podcasts at Power in Politics or watch on our YouTube page, CBS 6 Albany. We are joined today by Dr. Cynthia Leifer. She's an immunologist at Cornell University. Cynthia, we really appreciate your time. Thanks for doing this with us today.
Thank you. I really appreciate the opportunity to talk with you today.
Yeah, it's in relation, of course, to RFK Jr. canceling $500 million in the mRNA vaccine contracts that involves 22 projects as well. You've released a statement, quote, if you will, in response to that. Can you tell me a bit of what your statement said and why?
So I am very concerned about this. First of all, any cuts to research have devastation on all the academic progress that we're doing. We have students who are losing their opportunities to do their research. We have researchers in training who are losing their jobs. We have faculty who are losing their labs. And for better or worse, academics have been in partnership with the federal government for decades, 60, 80 years. And so there's a dependence on this for research. And when you cut those projects, whether they be mRNA or any other project, you're shutting down things that are half done. And what I was saying is, to me, it's like when you're doing a kitchen renovation and you've hired the contractors, you've put down the deposit, you've started making the payments, maybe you've paid for even half of it. They've deconstructed your entire kitchen. And now you're like, no, you know what? I think I want to save some money, so I'm just going to stop here. Not only have you not saved money, but you also have no kitchen. So it's really not saving money. And when it's something like the mRNA vaccines, it's even more frustrating because this is a development of a technology that's been happening for 25 years. And it came to the top, to the crest, to the absolute most amazing thing that we could have done with this is during a pandemic, we were able to develop a vaccine that saved millions of lives in record time. Because of the way this technology works, we can pivot, we can move quickly, and it is so much better than prior methods of making vaccines. And when the cuts are made and the Secretary of Health and Human Services says we want to go back to the way we were doing it before, we're going back to the dark ages, basically, of vaccines. We've come out of that. We have this new technology, and now they want to throw all of that away and move back to what we were doing before.
Yeah, you talk about the years of research that goes into this and that's currently being done for whatever the future might hold. And I think a lot of people don't fully realize that the COVID-19 vaccines, as they were being put together and then sent out, were the results of decades of research, not just research that had been done in response, right, immediately to the pandemic. Is that true?
Right. It seems when we say the vaccines were made really quickly, that can sound really scary. So I can totally understand why people are like, oh no, they were developed too fast. It was too fast. We don't trust them. We don't understand. I can understand how people feel that way. But what they don't understand is that people were working on the delivery mechanisms and the ways to stabilize RNA and the different components of the viruses in 3 different ways, in 3 different realms for years. And then when we were presented with this problem, this worldwide pandemic, they got together and said, let's just do this. And in fact, it was even before that, because some of these companies already had advanced some mRNA vaccines to the point where they were starting clinical trials at the time the pandemic happened. It wasn't obviously for SARS-CoV-2, which caused the pandemic. It was for influenza and other diseases, but they were already there. We were right on the precipice of this. And the impetus to just do this even faster and get it done quickly was the pandemic. But all of this was a long time in the making.
When he presented this, RFK Jr. said mRNA vaccines do not adequately prevent upper respiratory infections like COVID or the flu. What do you make of that? I'm going to probably ask you a couple of the different things that he's claimed with this.
Yeah, I think that the major misconception that happened during the pandemic and even till today is that if you get a vaccine, you have a Captain America shield and you will never get infected and you're going to be healthy and you don't have to worry about it forever. And that has never been the case and isn't the case now, especially for highly infectious respiratory viruses that spread really easily and also spread before somebody has symptoms. So if that happens, it's very, very hard to shut down that transmission cycle. But the vaccines do a really good job at keeping people healthier if they do get infected. We do have a couple vaccines that work like a Captain America shield, like for the measles virus, because when you're exposed to measles virus, it can take up to 21 days for the virus to cause the symptoms like fever and the rash. So that gives you a lot of time to reinvigorate your immune system if you've had a vaccine, and you really will never show symptoms. So vaccines work incredibly well in that situation. But in the case of a respiratory virus, we're not asking it to keep people from ever getting sick. That's an unrealistic expectation. But what it does do is really help those people who do get sick from going into the hospital or from dying. And the data are clear that these vaccines do work for those outcomes.
Part of his argument also was that the mRNA, he's claiming the vaccines encourage new mutations that can prolong pandemics. What about that?
That's an interesting one. If you think about it, it's called immune pressure. So this means that if the immune system is working really hard to keep a virus in control, the virus is going to do what it can to get away from that. That is true whether you have a vaccine or not. Your immune system is still going to put pressure on it. But what's more important is that if you have not been vaccinated, the virus has this opportunity to make way more copies of itself. And each time it makes a copy, it has an opportunity to make a mutation. And the mutations are random, and those mutations could lead to worse or less worse outcomes of disease, or even cripple the virus so it can't make copies of itself ever again. And it's a game, right? It's rolling the dice, but if the more you let the virus replicate, the more opportunity it has to make mutations. If people are vaccinated, there's less opportunity for the virus to replicate because the immune system will control it faster. If you don't have a vaccine, the virus will make more copies of itself and have many more opportunities to make mutations and evolve.
What do you also, how to respond to the updated warnings when it comes to myocarditis and things of that nature that have now been mandated to be added to the label, if you will?
I am all for adding appropriate warnings. They should always be there. And there is a chance of myocarditis with the vaccine. Those warnings can be there. I think the key thing that people overlook is the fact that the infection itself also causes myocarditis at a much higher rate than the vaccine. So when these studies come out that say the vaccine causes myocarditis, they're comparing it between people who got the vaccine and people who didn't. Does that happen? Yes, it can happen. We're not saying it can't. But if you compare unvaccinated people with vaccinated people and look at when they get infected, myocarditis is much more common and more severe in those people who didn't have the vaccine first. And that is a piece that's overlooked.
When it also comes to replacing this, if you will, they're proposing what they're calling a safer, broader strategy, a universal vaccine that mimics natural immunity. What's that mean to you?
I wish we had that. That's the holy grail. If he has that, he's been hiding it from all the research scientists who are working on vaccines. That's something we all want, but the problem with the approach he's taking is he wants to go back to the old way of making vaccines. They aren't really as effective, and they really aren't any better. And what I think is more tragic is that they are much slower to make. So if we're in the face of a pandemic again, all you need is a small bit of the blueprints of the virus. And once we have that, we can make an mRNA vaccine within a few days. We know how to do this. We can take the blueprints, we can make them into a copy of mRNA and start manufacturing a vaccine to be tested very, very quickly. The old method requires you to be able to isolate the virus and grow the virus at enough quantities to manufacture huge amounts of vaccine and then inactivate it. And just step one can be impossible, because if you try to isolate the virus, you might not be able to grow it in culture. Not all can be grown in culture. And so you may be stuck at step one. So to go back to that way of doing things, I think is really backward thinking and is going to put us in a really bad position if we face another pandemic and we need to create a vaccine that protects people really fast. Because we got relatively lucky this time. That sounds crazy to say. The death rate from COVID was about 10% when it first came out. Doctors got really good at treating patients and dropped it down to about 0.1 or 0.01%, right about where it is with flu. But we might not get so lucky next time. What if it is an infection that kills 30% of the people, 50% of the people? We're going to want a vaccine very quickly. We're not going to want to wait the amount of time it takes to make a vaccine by the traditional methods.
Yeah, and most data shows that 20 million lives were saved by the vaccine, the COVID-19 vaccine, 1.9 million in the United States. You alluded to this earlier when it came to the research impact of all of this, maybe beyond just the vaccine mRNA, cancer immunotherapies. What kind of impact on that does this have, these cutbacks?
We are just discovering, there is just even like last month, there was a study that came out that showed the promise of an mRNA vaccine in a mouse model for cancer. And it potentially, what they're touting as a universal cancer vaccine, which wouldn't that be amazing that you could treat all cancers? I don't know if we're there yet, but to shut down that kind of research now when it has that kind of promise that we could follow up and see where it can take us is just devastating. It's like we have a light at the end of the tunnel for something we can offer to cancer patients, and then just rolling a boulder at the end of the tunnel and the light is just gone.
Yeah, and I know that you mentioned this at the beginning as well. When it comes to the work that the students are doing, the professors, doctors, whoever is going to be there at Cornell, of course, this is probably impacting other institutions as well. How does this impact the day-to-day and what you're trying to get out of the individuals that are there right now?
Many of our students are very concerned. A lot of the students come from other countries. You might ask why? Because we are the hub for the cream of the crop, the cutting edge biomedical research that's being done. We are the envy of the world for where research wants to be done. So the students want to come here and get their training. And they're the top-notch students that we want to have in our lab. And yet they're, one, considering not coming here. Two, there's been, because of the insecurity of funding for the academic enterprise, many graduate programs cut admissions significantly in the last year by almost 50% nationwide. So we've reduced the number of students we're training. The ones that are here are not wanting to stay. They want to go back, and they don't want to keep, we're not going to be able to keep their knowledge and training here in the US, where we can advance biomedical research even more. And I think for me and my colleagues, what we are finding is that level of insecurity, because is your grant terminated? Is it not? Is the university getting funding? Is it not? Can you spend money? Can you not? Can you hire someone? Can you not? This disrupts science because science is ongoing. The discoveries are ongoing. If we have ongoing experiments, for example, where we're collecting samples from people, you can't just stop in the middle of the study because you have half the data, and it's also not enough data to be able to find a robust answer to the question that you're asking. So at the same time, you're stopping the research partway through, but you also can't really complete the research. So if you're halfway in the middle of your kitchen renovation, it's like, okay, well, now do the rest yourself. That's not really practical. So it is really interrupting all of the aspects of the research. And of course, if you have this level of stress, it stifles curiosity. It stifles the ability of new creativity for new ideas because you're constantly worrying about, can you keep the people in your lab? Can you pay your next bill to buy tips or pipettes or whatever reagent we might need to do our experiments?
Dr. Leifer, really appreciate your time. Thank you.
Yeah, absolutely. My pleasure.
Thanks for listening. Hit the subscribe button right now so you can stay up to date on these news-making conversations about the issues impacting New Yorkers the most: power and politics.